You're listening to the Autism Weekly podcast. Each week we share community voices and bring light to stories that increase awareness, acceptance, equity, access, and inclusion. If you haven't already, subscribe to join the Autism Weekly family. I'm your host, Jeff Skvitsky. This week, we're excited to welcome Dr. Bryn Harris to the podcast. Dr. Harris is a distinguished professor at the University of Colorado, Denver, with a dual appointment in the School of Education and Human Development, and then Department of Pediatrics, Developmental Pediatrics. She is also the director and founder of the Bilingual School Psychology Program at the university and a bilingual Spanish licensed psychologist who is also a nationally certified school psychologist. In this episode, we'll be discussing the health disparities in autism identification and the importance of culturally responsive assessment and intervention practices. Welcome, Dr. Bryn Harris.
Thank you for having me. I'm excited to talk to you about this topic.
Well, this is a topic that I love talking about as well, because it's something that I think that we need to be a little bit more aware about, and we have to start putting more resources towards. But before we get into the topic, one of the things I love to be able to do is just give a little bit of a platform to understand how you got into the field of autism, what sprung your interest. It's oftentimes a personal field, but it's also one that we get into because we've identified with a person or a family or a cause that really drove this. So how did you get here?
Yes, great question. So I was doing my doctoral work in school psychology, and I was doing some research pertaining to special education identification and the disparities that can occur within multiple different disability categories. Through that work, I was also doing a practicum and an internship in these different field placements where I would be, a lot of the times I'd be working with bilingual youth. I'm a Spanish speaker, as you mentioned before. And I started working with some of these families that had some symptoms that could be indicative of autism. And I started to wonder, how are we assessing for social communication in bilingual populations? I started asking questions. I started looking at some of the autism tools that we typically have and typically use. And I just wasn't confident that we were looking at the whole child when we were doing these evaluations. I didn't know how people were considering, for example, the native language or different types of language inputs that a child could be having at home or in different settings. I wasn't sure how that was being utilized within the autism identification process. And for that reason, I became really interested in autism identification, which of course then led me to other field placements, working more with kids that have autism. And I just have such a soft spot for these kids and families. And I immediately knew that that was where I wanted to pursue my future career.
So you mentioned kind of that language disparity and language differences. With autism, of course, is that communication is one of the hallmark deficits that you might see with autism. What were some of the things that maybe were misconstrued or missed because of it being a secondary language that the tools were assessing, or somebody's primary language might have been Spanish in kind of the studies that you did, where everything that we were using for tools was English language driven?
Exactly. That is the issue, is that sometimes providers didn't have a full understanding of a child's history and would end up assessing a child solely in English. And this might be a child that recently started learning English, or maybe has only learned English in a preschool setting. So for, a couple hours a day kind of thing. And so when you assess a child that way, you're only assessing for basically where they are in the language acquisition spectrum and not where they are developmentally. And so these children would often be identified for speech language impairments or be, potentially identified for autism. And I wasn't sure whether that was accurate, because the assessments weren't considering their native language and the abilities they had in their native language. Not to mention a lot of times, which I know we're going to talk about today, but a lot of times the interviews that we do with families, the developmental interviews, don't ask them questions about their language histories in that regard. We often ask about, when a child's first words were, give examples of how, in a routine, how they would ask for food or how they would play with a sibling. And those aren't questions that get at a child's language history if they are a multilingual learner.
Yeah, and I would imagine culture also plays a role in this as well, because sometimes even when we're speaking the same language, if you're from a different culture or the dialect is different, is that the words change, slang changes. And that's how, I mean, most of our communication isn't like the textbook language all the time. You're using a lot of
Yes.
slang, so you're probably missing a ton of language. So does it go beyond just the language itself and move more into you really have to understand the culture of the individual that you're assessing?
Absolutely. That's a really important point. So the families come to us with their own experiences, expectations, beliefs, values about how they should raise a child. And that is culturally driven. Language is also culturally driven. So the way in which families will come to us with any concerns or when they think that there might be a challenge or a problem within their family or their child, that is also culturally driven. It's based on what experiences that family has had and what they believe, how they believe they should address that challenge. So some families might be less likely to, for example, seek um, any kind of care through a health establishment or community care because of stigma related to disability, for example. Some families might feel might be more trusting in faith-based organizations, for example, or talking to other family members about challenges. And so that's very culturally derived. And then the way in which we raise our children, the types of experiences that a child has related to communication is very culturally driven as well. The way in which we're taught to speak to elders may be different. The way in which we we look at adults in the eye, the way in which we use gestures. All of these things are very culturally derived and can influence the way in which we interpret behaviors on an autism assessment.
And all of those things sound like they're extremely hard to be able to kind of generate all the research. I know that we're making some headway on that so that we can be more informed as practitioners. But I guess the overarching question is that you're looking at language disparities, you're looking at cultural differences. These children still need to be empowered at the same age. They still need to be able to have access to care at the same age so that they can start the trajectory they're hoping to be able to move on as far as being able to contribute every way they want to. So why is it so important that we're getting this right and that we can give appropriate diagnoses at the beginning?
Yes, that's so important. Well, one of the big reasons is that we know early intervention is such a benefit to children. We've been researching this for decades. This isn't new information for your listeners, I'm sure. But one of the things people don't consider is that early intervention is just as valuable for every child, regardless of language, regardless of culture. Though the language and culture needs to be considered and integrated into intervention to make them to have stronger outcomes for those interventions. But the early intervention is going to be the most effective for children with autism and families. And the other thing to note is that it's not only the early intervention, it's the accurate identification that happens prior to the early intervention that needs to be really comprehensive because remember, assessment is meant to guide intervention. It's not only for diagnostic or identification purposes. So a really comprehensive assessment will set up a child and a family for really culturally and linguistically responsive intervention services as well. And so by providing that identification process, we're also giving families valuable information about their children and their children's identity. And then, of course, the children themselves, when they're developmentally ready to get that information about themselves, it can be incredibly powerful to learn about yourself and your strengths and your assets and see culture and language as strengths and assets that can be integrated into your existing intervention resources.
And all of those things are important across all of healthcare, I would imagine, and not just for the population identifying as autistic or those that are caring for those that identify that way. But when you're talking about all of these issues, is that maybe you can walk me through kind of the history of how those assessment tools and evolved over time, and even how we're using them, because I would remember maybe 10, 15 years ago is that even translation services and getting the tools in the appropriate language to actually be able to communicate with the family was extremely hard to be able to do. And so maybe you can give us that baseline of walking us through where we started and where we're going with that.
Absolutely. Well, we have to remember that we really haven't been diagnosing or identifying autism for that long. I mean, this is a relatively recent history, if you will. I'm surprised that we don't have more research to date on populations other than primarily white males. But some of it makes sense because of the history with autism identification. Most of the tools that were created with white males because that was the population that was most likely to be identified at the beginning of autism identification, particularly families that were middle to upper socioeconomic status. So families that had the ability to access autism identification services were most likely to be identified. And then, of course, males, we still see that today as being more common. And then white males in particular. So what happened then is that when we created additional autism assessments, we wanted to match our norming sample and our standardization process to prior assessments. We wanted to see how our new autism assessment matched the findings from the previous one. And that's a very common practice in psychometrics. And so what ends up happening is that we get this, what we call oversampling of white males that continues to occur when we are standardizing an autism assessment. So it wasn't until really recently that we have some autism assessments that said, wait a second, we're going to do this differently. We're going to oversample other populations that aren't as likely to be identified with autism historically. And so we're seeing some of that. We still have a far way to go. We're seeing some strengths with certain assessments, but they're often just very large groups. So for example, only Black and Latinx populations, as well as white populations, for example. So really, what about all the other populations? And then what about all the families that are identifying as multiracial? How are they going to identify on this kind of standardization sample? It's a very complicated process. So I understand why the test publishers struggle with it. But at the same time, we need to have assessments that match our demographics. And we also need to be able to have assessments that are responsive to our needs as providers. So if I could talk a little bit about language. So if we're assessing a child that is multilingual, we currently don't have any autism assessments that are standardized with multilingual populations. We have some that have been translated into Spanish, and then some screeners primarily that have been translated into some other languages. But translation isn't the same as standardizing. So we don't really know how that assessment really might be different within different cultural populations we are using the assessment that has been normed primarily on white children. We're then translating that into Spanish or another language. And we don't know if, for example, that translation, maybe some words might be really complicated for a family to understand, or the meaning might be different than what we intended. And so we have a lot to do related to autism tools to really make sure that we're being responsive to a wide range of the population.
And I mean, I look in and I'm listening to all of where we might need to go, but I also know better is better. As at least we're seeing some steps in the right direction, but there's still a long walk ahead of us on this issue. Would you kind of say that, I mean, throughout the years, even as services and assessments have opened up, is that we actually created more disparity initially for underserved populations because we had the assessments that maybe were miscategorizing or they were giving incorrect information. And then you also had on the treatment end, providers kind of going to specific areas and setting up shop, which meant that there were whole areas of geographic space that and demographic space that had nothing going on still. I mean, did the initial way that we approach this create some disparity that we need to start chipping away at?
Yes, great point. I think we've been doing a really good job the last few years, just to start with a strength, in that, of course, no one wanted the pandemic. The pandemic did offer us an opportunity to change some of our practices, particularly related to telehealth. Um, and we have now some standardized tools for autism identification that can be delivered 100% via telehealth formats.
Mhm.
That is a huge thing pertaining to access because we have entire regions of states. I mean, I live next door to Wyoming, and we have regions in Wyoming that for hundreds of miles do not have any providers that provide autism services, but they can access telehealth services now. So are there benefits to doing in-person evaluation? Yes. Um, but we're talking about families that wouldn't be able to access any services if it wasn't for telehealth. So I'm very optimistic about some of these new technologies that are coming up. We have more apps, for example, that are intervention-based apps. We definitely need more research related to those. But that would be another thing that really has taken off in the last few years. But I wanted to go back to your original question about the way in which we've set ourselves up, possibly to basically reinforce these disparities. I agree with you on that, in that a lot of the autism identification, when it started, was really coming from academic medical centers, hospital settings, more in urban areas. And the other thing to consider too is that we did a very poor job and continue to do a poor job, but there's definitely strength there in this too, but of identifying girls in particular. That's a great example of how at the beginning when we were doing autism identification, we did not have questions on our tools related to camouflaging, related to some of the more nuanced social skills that are still there in girls, but might not be quite as clear to observers. Now we
Mhm.
have tools that specifically get at those camouflaging traits, and we have a lot of measures that are in development right now that will be specific to girls as well, and also non-binary individuals too.
Yeah, I remember back when the initial research started coming out that was a little bit more skewed towards evaluation of girls and being able to understand those characteristics. And I believe it had almost an instant effect on the prevalence rate that was being identified with girls. So
Yes.
there was stuff that obviously we were missing. But it goes back to that assessment piece, because in order to even go down the route of treatment eventually, is that you have to have a really strong assessment. You have to be able to understand the strengths of an individual so that you can start to empower them. So, what are some of the ways that doctors, specialists, psychologists can make sure that they have the flexibility to really evaluate the culture, the language as they're going through the assessment piece.
Hmm. Yes, such an important topic, and I wish we could talk for hours on this topic. So one of the primary things that I will say is that every provider needs to come into the assessment space with an understanding that culture and language needs to be considered throughout the entire assessment. So we're not just going to be picking the same assessment tools that we use for every child. We're going to be getting information at the beginning that will lead us to what tools will give us the most valid information for the child that we are working with in that family. And so, what are the ways in which doctors and specialists can make sure their evaluations are fair? One of the strongest practices in the literature is the use of family liaisons or, family navigators. There's a lot of different terms out there. But basically, helping the family access advocates that can help families understand the very complex medical community-based center, the community center boards, all of these different organizations, agencies that families are all of a sudden thrown into. It's very complicated. And these family liaisons, we know from the research now that family is more likely to go from an autism screening to an autism evaluation if a family liaison or family navigator is used. We also know that when interpretation services are offered, which should be 100% of the time, we're getting better at that. I'm still surprised that they're not always offered, but when
Mhm.
interpretation services are offered, families feel more connected to those providers, feel more engaged, and they're going to be more likely to share more information that is helpful for you.
Yeah, that makes a ton of
Yeah,
sense.
yeah,
And if you can communicate with somebody, of course, you're going to be more open, more trusting, and put more faith in that.
yes, absolutely. Yes. And then I'd say one other thing that's really important for all providers is that we need to be collaborative, especially in this time where we have long waiting lists for evaluations and service providers, and we have a lot of need and sometimes not enough staff, especially when we're talking about bilingual staff. We have very few available. We need to be better about collaborating across sectors, across services. And I don't know why that's been such a challenge because we've been writing about this for decades. Yet it's still very uncommon for healthcare settings and schools to actively collaborate. I'm not talking about sharing a report. I'm talking about meaningfully participating in the services that exist in all settings.
No, absolutely. And I mean, I would imagine is that part of the cause of that is that all healthcare professions are so taxed and so stressed in what they're able to do. I just even know trying to find a primary care physician right now is so hard.
Yep.
But I mean, there are ways to be able to do this. Is that if you
Mhm.
have, I mean, a lot of children who are autistic is that they're receiving oftentimes applied behavior analysis service, and but that ABA provider can go to a doctor's appointment if they need to and sit in and share that experience, share data. If there is a medication management change, have that in your data to be able to share. Hey, this is what happened when you made that modification. It creates that trust, I would imagine, for the family almost immediately to say, hold on, everybody is here to help my child, and they're not fighting, they're communicating, and it makes sense. Is that the
Absolutely.
sort of, I guess, the sort of collaboration and multidiscipline approach that you'd be advocating for?
Absolutely. Yes, that's a great example. I can think of a couple examples from my own practice because I also still practice 1 day a week in the public school system as well. And, a couple examples really revolve around not knowing the entire, the whole child, and the school system assuming a lot. So, for
Hmm.
example, I had an eighth grader girl. So that would be a atypical evaluation because that would be a much older child than typical. But unfortunately, we do see that more likely to occur in marginalized populations is a delayed identification of autism. So this girl, people referred her to me for an autism evaluation because she had a stuffed animal that she was carrying around everywhere, very attached to it, used it to speak for herself. There were definitely some symptoms that were consistent with potential autism identification. But then when I met with the family and I learned about an immense trauma that this family had just gone through, um, that trauma really explained her behaviors. Her behaviors did not start with that stuffed animal. They were not occurring prior to that trauma. So this family interview is so incredibly critical. And I think just the idea that we need to not assume that we know enough about the family. I think a lot of times someone else thinks, oh, so and so did a really comprehensive family interview, or the nurse did a really good developmental history. But then we're not sharing that information, or maybe there are some gaps in that information that we realize really late in the process. So, how are we really purposefully collecting information that really gets at the child's core symptoms, and assets, of course, too?
No, and I mean what you're describing is something that I'm really passionate about myself, is that having that community informed care model, when that community for that child is their family, their extended family, their school, their
Yeah.
friends, is understanding all of those pieces, because you can inadvertently create an absolutely wrong intervention plan if you don't know all of the components, and that could be medical as well. But what are some of the flaws that you're seeing as that transition goes into treatment? Because somebody's doing an assessment, and say they do a culturally appropriate assessment, get all this wonderful information. That doesn't mean it's being used, right?
Right. That's a really good point. So I think, first of all, in the assessment process, we also need to work with families to be advocates for their own needs and provide feedback to interventionists and providers about their own feelings around the intervention, how they think that their own values could be better integrated. And that is very challenging. I just want to own that to do that is difficult, but that can be part of our process in the identification process, is to help families understand that they are the experts in their children, that we want them to advocate, and that they have extremely valuable information to share. And so we can help them figure out ways in which they can provide that feedback to interventionists in a way that's comfortable for them. But I also think that this shouldn't really rest on the family's shoulders. I think this is a challenge that we as providers, as professional associations, really should be taking on. So, I mean, one of the things that I hope that we do more of is these grow your own type programs. So we have some research going on that is really exciting, looking at particularly Black families that have children with autism that participate in these programs to learn more about autism intervention and advocacy within their communities. They learn about how to access different resources. These families feel incredibly empowered after participating in these programs, and also they report feeling like they are stronger advocates for their children. They know more about how to adjust intervention, or ask for intervention to be modified based on their own needs. And so I'm really following this work. I'm hoping that we do more of that that really, because ultimately, I mean, it's if the families feel empowered, if the families feel like they're centered, they're going to come back to us for more. They're going to come and ask us questions, right? They're going to collaborate with us. That's the ultimate goal.
Yeah, and you mentioned it is hard, but sometimes the most important things to do are the things that are hard to tackle. And if it
Yes.
increases the prognosis of somebody being more empowered, being able to enjoy their life more, have a better quality of life, is that maybe we should be taking that extra step more regularly to be able to ensure it. One of the things that I find, I guess, very promising is that there are more discussions. There are more special interest groups that are saying we need to be tackling this more frequently. So what are some of the things that you're seeing on the horizon that are exciting for you that, and maybe even some of your own research, but what are some of the things that you're seeing out there that is like, hey, you know what? We're moving in the right direction. We're starting to see some progress.
Yes, absolutely. There's a lot of progress. I think a lot of the progress happening right now has to do with clinical training or training of providers in general. We now know that autism awareness in the general population and then among many service sectors is low. So autism knowledge as well. So we need to make sure that within our training programs that we are giving more information to providers around working with children and families with autism. And we are doing more of that. We have more grants, federal grants that will give training programs grants to do this. And then also we have a lot of different support, like from the Organization for Autism Research and Autism Speaks. And there's different places where we are getting support from professional associations to really build capacity among providers. I think we need to be doing a lot more when it comes to policy work. So how are we confronting biased beliefs? How are we confronting inequity in terms of, structural and systemic racism, oppression, a lot of the ways in which marginalized families continue to be, exposed to a lot of layers that will then lead to access issues or inappropriate assessment practices. We've been talking about this a little bit. So how can we move policies that really make sure that we are being inclusive of all populations, that we're, fighting for continuing to have interpretation funding, websites translated into Spanish and other common languages, having conferences where there's interpretation services available when we're doing these parent conferences. Basically, how are we engaging a diversity of families, not just doing the same thing over and over, but how are we going to the communities? How are we advocating for the voices that aren't heard currently?
No, and it's extremely important. I mean, unfortunately, the voices that aren't heard outnumber those that are heard at a
Yes.
pretty vast separation. But when we're talking about this empowerment and the ability for those to access resources or to start advocating or advocating for others, that requires direction. We need to know where to go. We need to know what resources, because that's where the energy comes, is that you know that, okay, if I go here, I can start learning more. I can start to understand the issues better, and then I can engage in that conversation better. What are those resources, or do you have recommendations where people could go to learn more about these topics to inform themselves better?
Yes, absolutely. So in your own context, I would encourage you to access whatever resources are available in your state or in your county. I'd be curious if you went on the website and looked to see what is available in other languages or what is available related to cultural considerations. Because in most situations, we're not finding that. We're not seeing families that can actively access resources easily from the community providers that they're seeing on a daily basis, or, the more regular providers. What we're seeing is that more national associations are providing more resources. So Autism Speaks, an organization for autism research, have Spanish language resources on their website. But that's only Spanish. We know there's lots of other languages that are spoken, of course, but that is something that's pretty recent too, which is really surprising. But those are some great places to go. They are going to be direct translations of other resources that are available. So we don't have a lot of resources that are going to be geared towards culturally and linguistically minoritized families in particular. They're going to be mostly translations of existing resources. We have a website called Color in Colorado, and they have a compiled list of resources for multilingual families that have autism, so that can be a great place too. There's a book that just came out, and it's related to females. So, Assessment of Autism in Females and Nuanced Presentations, Integrating Research into Practice. I really like that book. We really haven't had a book, a research-based book like that specific to assessment of females. We don't have a book like that related to marginalized populations. We have a lot of books in our field that will have a chapter on this topic, for example, but it's not going to be something that's integrated throughout, which is really unfortunate. And so I think that we need to be having more conversations about our own setting. So I want us as providers to pretend that we're a family searching for information. And we know that we have to go to this particular website, or I have to call this particular provider. I would do that and pretend that you're a family that, might not speak English or might have limited understanding of the medical establishment. How do you think we're being responsive to the families we serve? I'm hoping that we have conversations within our own context about that.
And over the years, one of the ways that I think that I've been humbled and that I've actually had to challenge my own ignorance in a lot of ways is by broadening who I am leaning on as colleagues and learning from a variety of different experiences. So when I look at organizations out there and even universities, it's trying to figure out, are we investing enough in hiring or bringing on new clinicians who have different experiences that then all of our clinicians can learn from. Everybody now has the resource to be able to talk amongst each other, to be able to understand how different cultures might see things slightly different, and it changes the way we practice. Is that kind of part of the resource that you think that we need to continue to evolve?
Yes, absolutely. So hiring staff that represent a diversity of experiences, trainings, languages, whatever it may be, that's always the ideal. We have a challenge in the way in which we train providers, in that it often is not seen as accessible or advantageous for marginalized populations to enter graduate programs, more advanced training. There are a lot of barriers to accessing some of these educational opportunities. And so as in universities, in training programs, we also need to be looking at our own admission practices, the way in which we are recruiting and retaining students, the way in which our programs are culturally and linguistically responsive, and how we integrate that content within all of our classes and field work. Basically, it is the onus is on the institutions, the universities, to really make sure that we are promoting fields to a diversity of different people, because that ultimately will impact the outcomes of the families that we serve.
Absolutely. And Dr. Harris, I couldn't appreciate you more for coming on because I feel always lucky and privileged in the fact that every time I have a chance to talk with one of our guests is that I feel like I'm having a chance to learn. It's challenging my own assumptions. It's growing my knowledge set as far as, hey, you know what? I probably need to go get some more information on A, B, or C and continue to evolve the way that I'm thinking through my practice. And I'm hoping that that does that for the rest of our audience. And I'm hoping that parents feel empowered to challenge their provider to say, you know what, I really would like to work with you on this and understanding where I'm coming from. But thank you so much for giving us some of your time today and your expertise.
Of course, it was really a pleasure. Thank you so much.
Thank you for listening to Autism Weekly. We hope you tune back in next week to learn more about autism in the real world. Autism Weekly is now found on all the major listening apps, including Apple Podcasts, Google Podcasts, Stitcher, Spotify, Amazon Music, and more. Subscribe to be notified when we post a new podcast. Autism Weekly is produced by ABS Kids. ABS Kids is proud to provide diagnostic assessments and ABA therapy to children with developmental delays like autism spectrum disorder. You can learn more about ABS Kids and the Autism Weekly podcast by visiting abskids.com. Thanks for tuning in. See you again next week.